sagittal situations, like a full class 2, the one we're seeing in this case, they might need from skeletal anchorage. We have to use TADS to solve these complex cases or extractions depending on the treatment plan. Because otherwise, if we extend the use of class 2 elastics for a long time, we might end up proclining the lower incisor, which is an undesired movement. For this reason, in this case, we're planning infrazigomatic screws to help us with the distalization. As you can see, we're distalizing up to 3 teeth at a time because we will be using an elastic. The patient will be wearing an elastic from the infrazigomatic screw placed in between 6 and 7 up to the precision cut in the first premolar, and also the patient will be wearing night class 2 elastics to help with some mesialization of the lower arch, some virtual jump, in order not to increase the number of aligners excessively. And this is why, if we take a look at the chart of movement, we are distalizing more than 3 millimeters, which is the maximum reasonable amount of distalization in both quadrants. As you can see, we're doing 2.8 in the second quadrant, and this is being performed after the extraction of the wisdom tooth with the use of an infrazigomatic screw. In this case, since the deep bite is also increased, especially in the lower arch, you can see the speed curve, how we have to intrude the lower incisors. We might use some TADS in the anterior segment to be able to intrude them in case we need them. It is okay enough in the upper arch with the infrazigomatic screws. We might change the force vector to help us with this retroclination and distalization of the patient. But it is quite important that we don't just place the TADS, but we also select when are we going to use sagittal elastics and what's the ideal staging for not to take too many aligners.